Good morning, everyone. I apologize. My voice is still crappy, and the daycare plague still exists. So I'd like to introduce my guest this morning, Dr. Lori Koger, and she is from upstate New York. And Lori, I'm totally unprepared. Can you tell? I know that you have a summit that you run that you started on natural, I believe, dog health. A few years ago, and it is every March, except I think that COVID year was a bit of an issue. So if you could give everyone a little bit of your background, what you're doing, as far as I know, you're still in private practice, a little bit of your background and a little bit about the Dog Summit as well.
Yeah, of course. So I'm Dr. Lori Koger. As Dr. Judy said, I'm in Albany, New York. Yes, we have snow and it's about 30 degrees. I'm sure you don't miss that at all. So I'm an integrative veterinarian. I work in a conventional practice part-time and do a little bit of conventional medicine and as much non-conventional medicine as possible. There are two of us who are on the integrative holistic side. My colleague does acupuncture and Chinese herbs, as well as pursuing physical therapy. So we provide the opposite of what some of our other colleagues do. The rest of the time, I work on my own projects and consultations, and the big project is the Healthy Dog Expo. If you want a wild ride, be an event planner who's organizing a 500 guest event and have COVID strike. It was unbelievable. We were supposed to be together April of 2020. And of course, could my timing have been even any worse? And so we are actually going to happen in March of 2022. And I know we're working on getting you guys there in some way, shape, or form.
So it's a 500-person event now. That's amazing.
Yeah, it is. And we just pray the Canadian border stays open so that Rodney and Susan Garrett can get through. Dr. Becker will, I think, still be in Arizona, so she's a safer bet. But my first venue closed, then I couldn't get dates, then there were restrictions, then nobody could travel. It's been an adventure, but I am totally optimistic that we will be there. And if you want to know more, it's healthydogexpo.com. We'll drop that in the comments at some point. But great speakers, amazing vendors, exhibitors, sponsors. I'm working on a couple of your favorite people, the folks from Viva Raw.
Yeah.
They sent me some of the most amazing product. I really love their stuff, especially the chunked ones.
Yeah.
So if you guys have not checked them out, if they can ship to you, it is a very high quality product.
Yep. Yes. And if you put the code Judy10 in, you will get 10% off your first order.
Oh, perfect.
And we are using their product all the time. Absolutely love it.
And one of the best things about their product is the packaging.
Yeah.
It's clean, it's easy to open, it seals back up.
And it doesn't leak.
It doesn't leak. I have had leaky raw. There's nothing worse. And then you've got containers and it's just a nightmare. No, first class product made by people who really care, which is what we're fans of.
Yeah, exactly. So we invited you to join us because we wanted to talk about the MDR1 gene. And so give me a little background. First of all, let's define what that is. I'm going to let you do that. And then a little background as to how you got kind of involved in doing research on this.
Yeah. The MDR gene, which is the multiple drug resistance gene, is a gene mutation that occurs in certain breeds. And in a nutshell, it prevents the dog and the cat from having a secure blood-brain barrier. So drugs that should not reach the brain because of this defect. And I first came to it through a friend of mine who had a dog. I, at that time, had Labradors. That was my breed of choice. And I met this incredible Australian Shepherd named Trip. And I just fell in love with this dog. I'm like, I want one of those. And actually, I want 2 of those. And the funny thing with Trip, he was a big black tri, handsome thing, very personable. But every time you went to pet him and put your hand over his head, he ducked down. And so I asked my friend, I'm like, Mary, what's up with that? I mean, the dog is not hand shy or anything, but every time anything goes over his head, he ducks down. She said, yes, he got ivermectin as heartworm preventative back when she lived in Syracuse. And he had a reaction to it, spent 5 days in Cornell's ICU. And they didn't know what it was when it happened.
How long ago was this?
That was in 1994.
Oh.
So they were just at the point of learning that some breeds don't tolerate ivermectin. And, Trip luckily recovered. I mean, he was in a coma. It was bad. And he was a young dog at that point, I think under a year old. So, nightmare situation.
Yeah.
But he was left with what they thought was a visual deficit in the field of vision over his head. Didn't affect him in any other way. He was a breed champion, an obedience trial, competitive dog, but he had this thing and he always ducked away. So, I was fascinated by this. And as time passed, we learned that Shelties, Collies, Australian Shepherds, some of the other herding breeds just did not tolerate ivermectin. And of course, people were using the cow ivermectin and dosing it down to dog size, which is a very challenging bit of dilution.
So your dog Trip, when he had the reaction, was he given a regular ivermectin heartworm product, like a heart guard?
No, he was farm product.
Okay.
Then, so, the dose that will prevent heartworm disease of ivermectin, the active ingredient in heart guard, is in micrograms. But when you're using it for cattle, you're dosing it in milligrams, and getting it diluted out is impractical and foolish, but it's cheaper. And sometimes owners take the cheaper choice. So anyway, it wasn't until 2001 that a researcher actually identified the gene that causes the mutation that allows for an incomplete blood-brain barrier. And the gene is actually ABCB1, and it codes for a protein that is involved in the transport of biochemicals across the blood-brain barrier. So a while after that, we began to have genetic testing, which is the most fascinating thing ever, that you can test for so many of these traits. But one of the first tests was developed at Washington State that identified the genes and told you whether your dog had the normal gene or the gene mutation. So you could have, because it's an individual, you have 2 genes, 2 copies of it. You could have 2 copies of the normal gene, 1 of each, or you could have 2 of the mutant genes. And obviously having 2 of the mutant genes is a serious problem. And those dogs,
so if they have only 1 of the mutant genes, will they be symptomatic?
They can be partially reactive.
Uh-huh.
So in a perfect world, you would never breed 2 dogs that either one had a copy of it, because you want to produce clear individuals.
Right.
But you can't base breeding decisions solely on genetic traits, because there are other things we want to perpetuate. But most people try not to produce anything worse than a carrier. And the carrier is the term we use for the dog that has just 1 copy of the mutant gene. I had a dog that I bred. I don't remember whether she was normal, or she had normal and mutant, but she reacted to minocycline. She was actually lived in New Jersey and got tick-borne disease after tick-borne disease and was symptomatic. And minocycline was a problem for her. Doxy she could handle at a restricted dose, but and that's not the typical drug that people think of as an MDR problem drug.
So which drugs, because in the past, I've always thought of it as an ivermectin problem. So that's
Yes.
interesting that you had a dog that had a
Yeah.
minocycline problem. What other drugs are involved with this that people should be watching out for?
Yeah. Acepromazine is
Hmm.
a common one. Butorphanol, a lot of our pre-anesthetic agents, because if you think about it, we're anesthetizing, we're trying to affect the brain. And these drugs become more potent in these individuals because it crosses the brain more effectively. So butorphanol, torbugesic, that's butorphanol, buprenex, buprenorphine. Any of the heartworm preventatives can be a problem. So think of even Interceptor, our preferred one, milbemycin, can be a problem for some of these dogs.
Right.
Moxidectin, which is what's in ProHeart. I think we're on the same page with ProHeart.
Avoid, run away,
Yeah.
run away.
In the trash. Even Revolution. And there are combinations now with our other favorite products, the isoxazolines or isoxazolines.
Yeah, so are those a problem for these dogs too?
I don't know that the isox component is, but now they're making them in combination. And you've got like Simparica Trio, I believe has moxidectin in it, and the isoxazoline and something else.
Yeah, I can't even remember.
Maybe topical medication or something.
Terrible.
Oh my God, that the dogs survive. I cringe when my colleagues in the hospital prescribe Bravecto because
so this is a little off topic, but how do you manage that? Because I own my own practice, so I never had to answer to anyone other than myself and the
it's
client.
called Merlot.
And see, I for years I've thought, well, I could go out and do relief work because I kind of miss practice, but if I had to go be a vet in a practice where it was expected that I would prescribe those chemicals or where I would have to give 6 vaccines at one time, I'd be fired in a heartbeat because I just couldn't do it. And I think, by the time I walked in and said, oh no, I'm not going to write the prescription for that diet, and no, we're not going to use that heartworm preventative, and no, we're not. They say, yeah, you're not making us any money, you're out the door.
Yeah. Well, couple things. I am blessed in that management does respect our differing viewpoints.
Good.
And so, they know I'm giving one vaccine at a time and I'm giving them at 4-week intervals. And I don't care, that if the owner wants somebody to give 3 things at once, we'll just swap the appointment to a vet who's okay with that.
Yeah.
So they let me keep enough of my personal viewpoint to keep me sane. I do have to compromise sometimes, and I do my best to politely educate the owner that there's another path, but I also really like the people I work with, so I do try to treat them with respect and just walk away and not start an argument, because they're good people and they think they're doing the right thing. And I just keep chipping away in small bits of, did you know about this? And I've got them now. I've got them sending out animal biome tests. I've got them using VDI, checking vitamin D levels, using their digestive stuff. So I get enough small victories of opening their minds. They can't do it all at once. You can't go from, prescribing science diet and vaccinating for everything and using Bravecto 12 months or, all year round to where we are. Yeah. So baby steps.
Yeah. Well, good for you for being able. I'm not sure I can do it, but
well, and I've cut my schedule a lot so I can work more within my passion, as they say.
There you go.
So I'm there 4 mornings a week.
Okay, that's not bad. That's kind of a nice schedule.
It is.
Okay, so people are asking
drugs. Some of the chemotherapy agents that people will use will need to be adjusted. And some people, Imodium is a problem, thinking of things over the counter.
Yeah. Okay.
Gastromotility modifiers.
Is there a list out there somewhere that you would recommend for people?
Yeah, the list is everywhere, but I would go to Washington State
Okay.
Veterinary School. And I've got a couple research articles that I'll drop the links in if I can figure out how to do that after we
Awesome.
talk. Or we'll get them out to you.
Yeah, you can always send them to Gwen and she'll get them posted. So
yeah, I'll email them to her after. And interestingly enough, they've identified this gene mutation in cats, and something which I was blown away by, because I never think of cats as,
no.
And most cats are domestic short hair. They're not purebred. They're not, the chances of two carriers breeding is small, but up to 4% of cats will have the gene mutation. And I think of the cats that now seem to be so sensitive to methimazole and other drugs. Maybe they are MDR cats.
Interesting.
And of course, cats do get heartworm preventative depending on where you live. So they are getting everything in the ivermectin class. Revolution is commonly prescribed for cats. A lot of the shelters use it because they can put it on a kitten, get rid of all the ear mites and everything.
Everything goes.
Everything. Yeah. Well, and it's convenient, and they've got 1,000 kittens.
Well, and frankly, we've got these barn cats that came in as, some of them we got from the Raleigh Trap Neuter Release program. So they were, feral cats that got trapped, spayed or neutered, and released. They had Revolution put on at the shelter. After having them for 6 months, my mom can touch one of them sometimes.
Wow.
But there's no way we can medicate these cats. And then we have a couple of strays that walked in and had kittens. There's no way we can medicate these cats. And so somebody had some really nasty diarrhea in the box one day last week. And I was like, well, you guys might have parasites. And if you did, so even if I run that stool sample, how the heck am I going to treat these cats? And the only thing I can think is, okay, I'm either going to try to hide something in food. Luckily, they are foodaholics. Or I'm going to have to try to trap cats and put something like Revolution on them. So I get it. I understand where, their push comes to shove. Sometimes you got to do what you could do. There's no way I can pin these cats down and orally give them something. So. Something
like that. Yeah. And that's the world. The world is gray.
Yeah, it is, unfortunately. Well, fortunately or unfortunately. So people are asking about Advantix and Advantix 2.
Advantix, no, I don't believe so.
No, they can't. Or no, it doesn't cause a problem.
No, it doesn't cause a problem. But the one they're thinking of is Advantage Multi.
Yeah.
Because Advantage Multi is Advantage, which the chemical name escapes me for the moment, but it has either moxidectin.
It has moxidectin, I think.
Moxidectin in there.
Yeah.
And they do use that, and especially in shelter settings, as a heartworm treatment now, as the ultimate slow kill. And again, it's a cost decision on a shelter or rescue's part, because they can put that on several months in a row and actually kill adult worms with it. But compared to doing the imidacide, which is ridiculously expensive for that audience.
Well, sure. Okay, yeah, the cat thing is really interesting. All right, let me find
it really is. We have a question about what should people in hot climates year-round give to their animals for heartworm and tick prevention.
So what do you recommend?
I do Interceptor if I have to. And I think of the people in Florida or in Louisiana where the risk is just astronomical.
Yeah.
And they have no choice.
Right.
You could say, okay, I'll test every couple months and catch it early. That might be something someone would choose. I would probably do the drug. And I would use the heartworm only dose, what we used to call the safe heart dose.
Yeah.
Because remember, Interceptor is formulated to prevent heartworms and also to treat and prevent whipworms and to prevent hooks and rounds.
Right.
So they roll the milbemycin dose up to cover for those intestinal worms.
Yep, multiply it by 5 times.
Yeah. If I'm only interested in preventing heartworm, I can look up the dose. And basically you only need then the brown and the green size.
Right.
Green size will treat a dog up to like 100 pounds for prevention of heartworm.
Yeah, so the brown size, it goes up to 50 pounds, and then
Yeah.
the green size is 51 to 100. So since we moved to North Carolina, when we lived in New Jersey about 5 years ago, I quit giving heartworm preventative. I was getting more and more. I mean, I've been an integrated practitioner for a lot of years, but over time, I kept shortening my heartworm schedule, and it was, then I got down to they were getting 4 pills a year over the summer, and I just finally said, this is just dumb, because in my practice, we saw very little heartworm. 90% of the heartworm cases that we saw were dogs that were being brought up from the South through rescue, particularly after Hurricane Katrina. I mean, if you think about, after a hurricane, there's all the standing water. The mosquito population is crazy, and a lot of dogs were strays and lost their families.
Yeah.
And so that caused a huge issue, and we saw a lot more heartworm. But it really was the dogs coming up from the South for the most part. So when I looked at that, I just said, we just don't see it very much in our healthy dogs from our area. I quit giving it to my dogs. They didn't get it for 5 years, and then we moved south, and everybody said, what are you going to do now? What are you going to do now? Well, we've made it through our first year, and I still don't give heartworm preventative. But
and what's the mosquito load on your land?
Yeah, so the mosquito load on our land is not bad because we don't have standing water. We have a ravine that pretty much goes all the way around the property, but it is far away from our house. My dogs don't go anywhere near there, and generally doesn't have water in it. And I have couch potatoes. My couch potatoes don't spend much time outside. So I look at their risk level, which is very small. They're just not really exposed. If I had a farm dog who was an outdoor dog who was out, guarding the animals and living outside all the time and outside in the evenings when the mosquitoes were at a higher level, I would be more concerned. But we just don't have that risk level for our particular pets. So it is an individual thing. And that's one of the things that I know that most of us holistic or integrated veterinarians get frustrated with, that the veterinary profession wants to make a one size fits all instead of looking at each pet's individual risk for whatever it is, whether it's a vaccine or heartworms or intestinal parasites, whatever.
Yeah, I saw a question through here. What is the difference between Interceptor and Interceptor Plus? And Interceptor Plus is Interceptor plus praziquantel, which is a tapeworm medication. Who in the world decided we needed to treat our dogs for tapeworms every single month? And keeping in mind, that's an expensive drug, praziquantel is.
Yeah, and not without side effects.
Tapeworms, unless they're loaded with fleas or out there eating rodents, they're not going to get tapeworms. So do not buy Interceptor Plus. Please do not waste your money. Do not give the extra drug to your dog.
The one that really gets me is the Sentinel Spectrum, which is
so
it's milbomycin, which is the active ingredient for heartworm prevention in Interceptor. So we have milbomycin, and then they put in lufeneron for fleas. So it prevents flea eggs from hatching. And then they add praziquantel, which is a tapeworm dewormer. Well, basically what they're saying is our flea prevention doesn't work. So your dog's going to get tapeworms. So you have to deworm them for it's an oxymoron. So that one makes zero sense at all.
Yeah. I also saw some questions about, do vets know about this, about the MDR gene? That
was one of the things I was going to ask. So I think there's very few veterinarians out there who don't know, who have never heard.
They know collies, maybe.
Right. They know that it exists.
Yeah. They don't know how to test for it, which brings me to, I was shopping Black Friday. So my puppy got her embark test.
Gwen did the same thing.
Yeah. It's like, oh, you need this. So I thought I would just take a moment and show you guys. They tape it up really well. So you go, and there's probably still a Black Friday, Cyber Monday special. and they mail you this thing, and you get a little cheek swab. So make sure your dog's mouth is clean and food-free. Swab their cheek according to the directions. I don't know what else is in here. Oh, that's actually, oh, we get a plastic bag and a direction card. So it's easy, trust me. I advocate for testing your dog. If you have a breed that's prone to it, obviously Collie, Sheltie, Aussie. Border Collies, yes, but only 5% are about infected. Whippets, Silken Windhounds, English Shepherds, McNab Shepherds, some of these other breeds that we're seeing more. The Silken and the Wind Sprites too, which are Whippets crossed with, in the way in the back, most likely Sheltie. So if your breed is prone, get a test. And then what will happen is,
so on the Embark test, will that tell you if they're a normal, mutant, or mutant normal, or will it say they're a double or a single carrier?
It will. So I wasn't going to download the whole thing, but this happens to be my dog.
Cool.
And so she was tested for 140 some things negative. These were the breed relevant conditions that she did not have. So that's a normal, that she on Embark was normal for everything. They give you a whole PDF download to give to your vet. They give you, it's beautiful on the website. You can download it, you can email it, you can give your vet a link. So you as the owner need to educate your vet. I really think that's the bottom line. The vets don't always know the drugs. And as you said, they know the condition exists, but they don't know your dog has it.
Right. So, they don't know whether your dog has it, and they don't know. I mean, frankly, some of the drugs that you mentioned, I was not aware were on that list.
Yeah.
So, and it, I can tell you all the things that Cavaliers have problems with, but when it comes to, and a lot of veterinarians are that way. Like, we know a lot about the breed that we do the most work with. I had an office manager who was a bulldog rescue person, and let me tell you, while she worked with us and we did all the bulldog rescue work, I learned so much about bulldogs that I never knew. But that's how you learn, by working with certain breeds over and over. So if someone's dog, so let's say someone has a Sheltie, Collie, Aussie, whatever. Yeah. They haven't had any testing done, and they give their dog heartworm preventative, or their dog goes in for surgery and some of these pre-anesthetic drugs are used. What symptoms would they see if the dog was having a problem?
Typically anything neurological, from profound sedation, the dog who gets spayed and is sleepy for 3 days, to even worse than that. Tremors, seizures, visual changes, anything that has to do with the nervous system. And I usually tell people, I'm a conservative person by nature with drugs, and especially with breeds that have sensitivities. So, if I see an Aussie, I automatically dial down my pre-anesthetic drugs, my other drugs that are higher risk drugs. It's like I'll take the dose down 25% or so. If I have any hint that the dog has had a previous drug reaction, I may elect not to use a drug, or I may dial the dose down by 50%. Because, having had dogs that could have been carriers that reacted, I don't think, just having one copy of the gene, that you're safe. If you even, why would you take a chance? Like my conventional colleagues will give an Aussie heart guard. I'm like, what the are you doing? You don't know this dog's MDR status. And even if it's normal, why would you take a chance? Maybe there's another gene that we haven't found yet that is involved in this problem. And we know Interceptor is better tolerated by dogs with the MDR mutation. So why are you giving heart guard? Or probably the best advertising line they have is, well, the dog enjoys it. His once a month treat. I'm like, my dogs expect a treat every couple hours.
Yeah,
Once a month.
I think we find a different treat.
I think we could. And you know, those things that Heartgard is made in are actually sausages. The grocery store sausages.
Those are so horrible.
Yeah, well, that's what Heartgard is. That's the inactive ingredient, and that's why the dogs eat it. Total junk
You know what?
food.
I didn't have Heartgard in my clinic, I think ever. So it's been 25 years since I've even, like handed out a box of Heartgard. So
now what the drug companies do, and forgive us for digressing, guys, they send you a whole bag of the sausages treats, but they're labeled as Heartgard without Heartgard in it, so that you can show that the dog will take it to the owner in the exam room. Here, I have the base chew. Your dog can have one. And it's like they send you a 3-pound bag or two to give away.
Lovely. So yeah, anybody who hasn't looked up sausages, next time you're in the grocery store, go read the ingredients. You'll be amazed. It's just so disgusting. Have there been any studies to see if there's a correlation between MDR1 and hemangiosarcoma?
Not that I'm aware of.
Yeah, I don't know of any either. Are the dogs that carry the gene more likely to have degenerative myelopathy?
Another interesting question. I don't think anybody's made the correlation, but look at the Embark panel. The DM testing is in there. For the money, the health testing that Embark provides is an amazing bargain. And yes, you can get MDR tests and breed-specific tests done at Optogen, at Animal Genetics, at Paw Print Genetics, at Washington State, and other university labs. But Embark does it all in one at an affordable cost, and they do bank samples for future research in association with Cornell. So your dog's DNA is giving benefit to the future.
Right. So they can do more research, because I know that I think it's Basepaws with the cats. They're doing the same thing where they bank everything, and then you get updated information as they discover new things. So I think it's amazing that these companies are able to do it. I only had a few clients. I didn't work with many breeders, and I had a couple of breeders who would do the genetic testing so that they could see what their dogs might have an issue with and try to help pair up dogs that could be bred together, which is great that breeders are willing to do that and are willing to actually look at how pairings are made. I mean, a couple of my dogs I got because they were supposed to be in breeding programs, and they were pulled out of breeding programs, which they're great dogs, so yay me. And yay for the breeder who is responsible enough to take a dog out of a breeding program because there is an issue that potentially could be passed on. So very appreciative. But even if your dog is spayed or neutered and you're not planning on using your dog for breeding, having genetic testing. So let's say your dog comes up positive. I know my sister has corgis, so DM, the degenerative myelopathy is huge in that breed. So she always has her dogs tested for the DM. But I think she's testing specifically for that. And I think it would make so much more sense and be more helpful if you could have your dog tested for 144 or whatever it is that Embark does, different things. And it also helps you to be proactive. So, I mean, let's look at the Cavaliers with the mitral valve disease. Well, if we've got genetic markers for that, and you can be proactive, although I'm finding a lot of the Cavalier owners are just being proactive with supplements, diet anyway. The chances are high.
Unfortunately. But anytime, I've never regretted the times I was proactive and sought more information ever.
Yeah. This person says her dog's a Karakachan, never heard of it, not a common breed, and Bark doesn't have any in their database. Would you still be able to get her tested to find out MDR status? I would think so.
Yeah, they just, one of the other things Embark does, and this is not a commercial for Embark, I get no money for this. They will share what they call relatives, dogs whose have, 30 or 35% of the DNA in common. which is really interesting because I get these notifications that Flair has a new near relative. And sometimes I look at the dog and I'm like, oh yeah, I can see how that dog is bred. Or, oh my God, it's another Rowan grandson and she's a Rowan granddaughter. And it's kind of fun to see what they have, and you don't get to see their results, but people share a lot about them.
Yeah, yeah. So I mean, I think it is really important, as the owner of the pet. Veterinarians don't like to be challenged, so you have to be very careful how you do these things. But coming in and providing them with more information and say, look, I had my dog tested. I know that my dog is a carrier for MDR1.
Yeah.
You might get blown off with it's just a carrier, he's not going to be symptomatic, but we don't know that. So right. It's worthwhile. So if you have a dog with, a carrier or a mutant, I would be printing out that list of drugs and taking it to the veterinarian and saying, okay, well, these are the drugs that potentially could react. But just remember, there are other drugs that may not be on that list yet, because there's
or adjust your dosing.
Right. But it's worth making your veterinarian aware that there, is potentially a problem with this breed. I don't know that. Actually, I did back in the 90s, kind of about the same time when your dog had the issue. I was working in emergency, and we had a couple of dogs who had the reactions and very neurologic seizures, tremors, weakness, couldn't stand. And if I remember, I mean, we're going back a long time, but if I remember correctly, that over time they sort of detox themselves and it sort of works its way out of the system. Yeah. So most of them will recover. Are there dogs who don't recover?
There can be damage. And yeah, there certainly were dogs that died of cattle ivermectin. Usually the dogs that seizure carry a horrible prognosis. And sometimes, people don't catch it at first. They think it's something else.
Well, and that's unfortunate, because if your dog is on Heartgard or the cattle ivermectin or some other drug, moxidectin, whatever, and the dog is having a reaction and you're not aware that that's what's causing it, you're continuing to give it, or things like the ProHeart injection, which is moxidectin, you're going to get one of two things. You're going to get a drug that lasts 6 months, or you're going to get a drug that lasts 12 months. And once you inject it in, you cannot get it out. So if your dog is a carrier and you don't know it, or your dog is a mutant and you don't know it, and they're given a ProHeart injection and they start having seizures and neurologic problems,
that dog, it might not happen quickly because it's got to accumulate. Right. Now, one other scenario that people were worried about for a while, people who live on farms, cattle, horses that got dewormed with ivermectin. And what do dogs love to do but go out and eat horse poop? That's a concern. So you don't take your ivermectin sensitive breed dog to the farm when they've just wormed the horses. Let them eat poop, because it's possible for them to get a toxic dose.
Now, I had a dog with a horrible reaction. They were deworming the horses when I was working in emergency. They were deworming the horses, and the horse dropped a huge blob of dewormer on the ground, and the dog swooped in and ate that blob of dewormer, which was enough to treat a large horse. And this was a 40-pound dog. And actually, thinking back on it, I have a feeling it was one of these herding breeds. But interestingly enough, in addition to that, the dog was also heartworm positive, and they didn't know it. So when it ate that huge amount of ivermectin, it caused a huge die-off of the microfilaria from the heartworm. So this dog was having seizures. It was in anaphylactic shock. It was like the biggest nightmare ever. But interestingly, we got the dog through it. It was kind of one of those, as I'm questioning the people, they're like, well, the only thing that happened today was the dog ate this big blob of ivermectin. And I was like, oh.
Yeah. John just brought up a point that I wanted to bring up. Is flagyl or metronidazole dangerous for a carrier? We know metro can cause adverse reactions that can look neurologic
Yeah.
or be neurologic. It's thought currently that the mechanism is not, that it's not an MDR drug, that it has its own mechanism. So yes, you can use Metro in MDR mutants or mutant dogs, but I would adjust the dose and still could have a reaction that's by another mechanism.
Yeah, yeah, I have seen neurologic problems with Metro. Actually, one of my dogs, one of my Cavaliers, 2 doses of Metro, and she would be completely down, not able to walk, unable to rise.
Wow. Wow.
So yeah, Metro went out
Well,
the door for her.
right. And the dose range on Metro, some people dose it really high.
Yeah, go low. But
Yeah.
I got to the point I found herbs that work better, so I don't recommend using Metro anyway. How long after worming my horses should I keep the collies out of the pasture? How long does the drug stay active?
Well, the drug will be active in that manure. So what I would say is give it to your horses at a time when they're going to be in a stall, and you can just remove the manure. Harder for cattle, but for horses, relatively easy.
Good idea. Good idea. Dog's a carrier just diagnosed with epilepsy, started having seizures at her first birthday. She's on Interceptor in the summer. Is MDR1 and epilepsy related?
Generally, I don't think of them as related, but you've got an abnormal blood-brain barrier, so it's certainly possible. Some of this research, the research projects that could come out of this are just incredible, but the logistics of doing them probably way too challenging.
Yeah.
Seizures at a first birthday, that's a little bit young, but not outside of the range of classical epilepsy.
Right. Yeah. And I would also look at, I'm seeing so many of these dogs that have been given a dose of an isoxazoline flea and tick preventive.
Well, now Bravecto's out in puppy sizes.
I know.
So they size it down for the size of the dog as it's growing and label it for 1 month.
Right. And so you're giving a 3-month drug monthly.
And there was rumor that somebody was working on one that would last 5 months. And it's like, does this stuff ever come out of their body? I doubt it.
No, I can tell you that I had clients who had given 1 dose, and a year later, anytime they pulled a tick off their dog, it was dead. Like, it was still killing ticks.
Oh my God. Yeah.
Later. So
I just can't fathom putting something in a body of any species.
Yeah. So somebody says again, so if horses are on pasture, how long is the dewormer active? Well, it doesn't really break down in the environment.
Right. So it's just, does the manure break down so the dog doesn't eat it?
Right. Yeah. So, with time, we've got a ton of animals out in our field, although our dogs don't have access to the field, so they're not eating poop. But with time, it rains and the poop breaks down, and then it
dries out and gets kicked around,
breaks down into the soil. So, but this is one of the problems that we have with a lot of the drugs in the environment. The waterways in Europe are highly polluted with fipronil, which is the active ingredient in Frontline and a lot of the topical flea and tick products. So, we're all being exposed to this, our animals are being exposed to this. We're polluting our waterways. It washes, that ravine I talked about. Well, when it rains, everything washes downhill.
Yeah, the environment definitely becomes contaminated.
Yeah, for sure.
Yeah.
So the herb I'm talking about, comparable to metronidazole, is called Coptis. It's on our website. I'm in love with this herb for hot diarrheas. For those of you who do TCDM stuff, hot diarrheas, that's going to be diarrhea with blood or mucus. It's the most amazing stuff. And human studies have, they've done a lot of human studies comparing the use of metronidazole for people with like ulcerative colitis versus using Coptis for people with ulcerative colitis. And they found that using the Coptis, people actually improved faster with 0 side effects versus the metronidazole. There's potential for side effects. Besides neurologic problems with metronidazole, I've seen it cause aplastic anemia. It can cause a lot of problems. So it's not to be taken lightly, and unfortunately, it is taken lightly. It is handed out like candy anytime a dog comes in with actually even cats, but more so dogs. But it's handed out like candy for diarrhea.
Well, and I don't know if this is your experience as well. Owners can't cope with their dog having diarrhea, but yet they don't realize they should like give a little fast, maybe skip a meal and let everything just empty out. To me, that's just second nature,
Right.
and not just dive in with drugs at one little episode of diarrhea.
Yeah. All right. So it's the same in the dog poop. I would, yeah, for sure. So you have a mixed breed who takes hard guard and a poop eating Sheltie. So if you miss, is the Sheltie at risk? I would say yes, particularly if your Sheltie is
If there's a big dog, little dog thing, there could be enough.
Yeah.
The companies will tell you, the heart guard company will tell you the dose that they put it in the dog product is safe for MDR dogs. But yeah, I think it's definitely possible. Your Great Dane poops out a bunch of heart guard and your little Sheltie eats it.
Yeah. Now with the heartworm preventatives, the heart guard, the interceptor, if I remember pharmacology correctly, which was a very, very long time ago, it basically is in and out of the system in about 48 hours. It does its job, goes in there, kills the migrating larvae, and it's out of the system in about 48 hours. So
maybe even 36.
Yeah, so it really is a matter of keeping your Sheltie from eating the poop in that first 24 to 36 hours. All right, somebody says, what are your thoughts of diatomaceous earth, edible and environmental? I don't know in what context we're using it, but
I've had people tell me they use it as a dewormer, as a external parasite control. I'm not big on feeding it. I'll use it in the environment, and boy, you make a little trail around a favorite plant that the ants are going for, and it stops them cold.
Yeah. Yeah.
And very safe in the environment.
Right. Yeah, interesting. The Veterinary Botanical Medical Association, they have a very active email group, and there was a big discussion about oral use of diatomaceous earth, food grade diatomaceous earth, and they were really against it. If you could look at diatomaceous earth under the microscope, it's spiculated. It's like this.
Spine.
Well, that all the pictures we see of the coronavirus with all the little spikes sticking out of it. Yeah. Well, it kind of looks like that. And those little spikes, the why it works against parasites is they're kind of raking down the intestines, and they're kind of grabbing onto things, and they're drying out the parasites. But it can be very abrasive to the intestinal tract lining. And that was, most of the botanical medicine veterinarians were aghast and shocked that people were using it, particularly using it for like months at a time. And they were very much against it.
Definitely. Ooh, sorry. And someone said it works great for slugs that are attacking your hostas.
There you go. Yeah, I think using it environmentally, I'm all for that. I've had people who have used it that live in hot, damp environments, and they have chronic flea issues. Being able to make a perimeter around the house where the dogs go to try to, make a flea safe zone. Can damage from these preventions and vaccines cause pancreatitis? Yes, because pancreatitis is an inflammatory disease. So anything that sets up inflammation in the body can contribute to pancreatitis, for sure.
Definitely.
250 milligram dose of metronidazole for a 50-pound dog. That's probably on the lower end of the dosage spectrum.
That's like 10 mg per kg. Yeah. That's probably safe.
Yeah, it's probably safe, but who knows? I mean, we never know who's going to react and how. I've had cats react. I've had dogs react. I had one patient that got aplastic anemia after multiple transfusions, all kinds of treatments. The university said the dog's going to die. There's nothing we can do. Luckily, acupuncture, herbs, and diet change did manage to get this dog turned back around, but there's no guarantee that you can get things turned around when they have these reactions. So
and I would just add, consider what alternatives exist, and maybe you don't need to reach for it at all.
Yeah. Is there a typical reaction or lasting effects from giving a mutant or normal mutant dog some of these drugs?
Well, like early on, I don't know if you were on early, when I talked about Trip, anytime you went to pet him on his head or anything came over the top of his skull, he ducked down like he couldn't see it clearly
Yeah.
or, perceive what was going on. So yeah, you can have lasting neurological sort of things.
Yeah, and it's really interesting. I see that sort of response. Like we'll have people say that their dog's behavior suddenly changed, and I see this a lot with the isoxazoline drugs,
Yeah.
which again they're affecting the neurologic system. So they're affecting the brain, they're affecting the spinal cord, they're
Well, and
affecting the
technically
nerves.
speaking, they are not drugs, they are pesticides
Exactly.
that interfere with neurotransmitters.
Right. So I see the same thing. So we've had dogs that developed dry eye because it basically killed off the nerves supplying the glands that produce the tears to the eyes. It's not reversible, folks. We've seen optic neuritis and changes in the retina because of the nerve that supplies the eyeball, the optic nerve being damaged. That the nerve gets inflamed, and then the nerve says, "I quit."
Yeah.
So we can see long-lasting effects from these things, but we do have a lot of dogs that have behavior changes. Like all of a sudden they're growling at the owner approaching until the owner gets close enough and they realize it's them, which their sense of smell should be able to tell them that. So is their sense of smell also being damaged by this? Suddenly being very reactive on leash walks, suddenly being very reactive with traffic going by where they weren't before. So if you have a dog who is having a sudden behavior change, look at what drugs have they been given, what treatments have we done, and or even vaccines, what's been done in the last 30 days that because neurologic problems don't always happen instantly. Sometimes it takes a while for that inflammatory reaction to set up and for that inflammation to travel along the nerve pathways. So it's not always something that you see instantly. And unfortunately, that's a lot of times how the drug companies have an out, because they say, well, if it didn't happen within the first 24 hours, it couldn't have been the drug. That's not true.
No, not at all. And to add to that, back when the isoxazolines first came out, I did a blog on the approval process and the low number of dogs that they ran through. It was like 300 dogs. And for their field study, they used the dogs that belong to veterinary staff usually. Here's free drugs, people, or free pesticides. You just have to tell us if you see any abnormalities of your dogs. And, sometimes they gave it 300 cases, 300 dogs, and 150 got the drug, 150 got the placebo for 6 months, and whammo, it's approved. Then you get it out in the general population, and hundreds of thousands of dogs are taking it, and you start to see what the real adverse reaction is.
Exactly. Somebody asked about gabapentin. Is that on the list of?
I would put it on the list.
Okay.
Definitely.
Definitely gabapentin affects the neurologic system. That's how it works. It works at the level of the nerve root. So we do get animals that become ataxic or wobbly, become very lethargic, definitely show neurologic symptoms with it. So,
and I would also adjust, if anybody's still using it, I don't know why, tramadol.
Oh.
I
see tramadol used a lot, and I took a pain course, and tramadol is only effective in 20% of dogs. So,
and it's only effective for about 5 days. And then the body acclimates.
And so what happens is we end up giving higher and higher and higher doses.
And all it does is sedate the dog.
Right. And so we get more and more neurologic side effects, but no pain effect. So
yeah. And there was a great paper that was actually published in the Journal of the AVMA about how ineffective tramadol was, and yet we still have people prescribing it. And it's a controlled substance and a gateway drug. Just a bad idea all around for me.
Yeah, exactly. Has there been a relationship shown between giving certain meds and CCD dementia in dogs? I think a lot of, we're affecting their neurologic system. It depends what the drugs are. But a lot of these drugs, particularly if they're given chronically, they're building up in the system, and every drug can have a side effect. Every herb can have a side effect. Every vaccine can have things that are good for us can have a side effect. So, the goal is to not have your pet be on high doses of chronic meds, multiple chronic meds. And it's interesting being in the holistic sphere over the years, my dogs have been their number of drugs and doses of drugs have gone down, down. I need their heart meds to keep them alive. We're kind of stuck there because I've got to breed with those problems. But all of the drugs for their neurologic problems, for the SM and the CM, which is a Cavalier problem, a few other breeds, I've gotten rid of all the drugs. I had dogs that lived on gabapentin for years, and I've managed to get rid of the drugs, and they're so much happier and less symptomatic when we get them off of that stuff. So, that's your goal. But unfortunately, if you don't have an integrated or holistic veterinarian to work with, it can be very tricky and it ends up you're going to have to do a lot of the research and then take it to your veterinarian and hope that you can have a conversation with them.
And I find the dogs that have never, like my dogs get basically nothing. If I need a drug with a dog like that, I don't need the classic textbook dose because their system has not been insulted repeatedly. So I can, with a minimally drugged dog, go half dose and still get good effect.
Yeah. Here's an interesting question. Is it just drugs that affect MDR1? What about foods, vitamins, and essential oils? The essential oils is the one that kind of catches my eye.
That catches my eye as well. Could synthetic vitamins be absorbed? Possibly, but foods, I don't think so. Right. Essential oils, what I would do is I'd call up Melissa Shelton and ask her. Exactly. To be real, you want the expert on essential oils and vet med. But that would be possible. And I would also say CBD, depending on how it's extracted and what proportions of the cannabinoids it contains. And I wonder too, if that is a factor in how effective CBD's particular brands are with individuals.
Interesting. Have you seen negative side effects from CBD in these MDR1 dogs?
I've not seen negative side effects. And I've seen lack of efficacy.
Okay.
And I've also seen, and I don't know the MDR status of some of these dogs. I've had people put seizure dogs on it and it seemed to provide seizure control. I've seen anxious dogs respond favorably. But again, mixed breed dogs, unknown MDR status.
Right. Yeah, so I think the takeaway really is get your dog tested, genetic testing, whether you have a breed that you're worried about MDR1 or just in general to see what possibilities, and it'd be nice to test them when they're young. So you're like, oh, here's my roadmap for the future. This is what I'm trying to prevent. This is what I'm trying to avoid.
Well, and actually a breeder could test puppies. I mean, it's just a cheek swab. You can also, depending on what testing you're using, you can use blood. But, for a breeder to have this tool available for thinking of Embark, all the genetic tests, before 8 weeks of age, whether the dog is a candidate to stay in your breeding program.
Awesome.
Or whether there's a problem they need to address.
Awesome.
Yeah.
It's interesting. I don't know how long these genetic tests have been available. I know for specific things like MDR1 and DM, those have been around for a long time, but these companies that are doing, and like you said, there are multiple companies that are now doing it. Companies that are doing kind of an overall, like you get 150 things looked at. I think that it is not talked about enough. It is not used enough. And it could really advance veterinary medicine a lot if we looked at it more, how we could help our patients, because we would know, we'd have this list of things like, oh, okay, this dog may have a problem with this, or this cat, there is base policy for cats. So let's say your dentist used alfaxan and isoflurane regional dose of bupivacaine, buprenorphine, and he developed idiopathic epilepsy in less than a month.
Hmm.
Well, the buprenorphine is on the
Maybe
list,
it's on the
so
list.
maybe.
I wouldn't think to be bupivacaine. ISO
Uh-uh.
certainly breathed out. Um, it's funny. I always worry, and I don't do many dentals anymore. I have a colleague who loves doing them, and my employer actually went for some advanced training, so I'm off the hook. But sometimes when we are cranking around in these dogs' mouths, we cause nerve damage.
Yeah.
I think of this one dog that, and if your vet uses those metal mouth gags that hold the dog's mouth open, those are really, really bad. And especially bad in small dogs and cats because they put so much tension on the jaw. They're actually stretching some of the cranial nerves. And you'll get a neuropathy after that. We had a cat wind up blind post-dental. And that was a lengthy dental with a mouth gag used and a lot of extractions and a lot of torque on the cat's head. So a dental is not always a benign procedure, if you will. It may be.
We had quite a few that went deaf after their dentals.
Oh, really? Yeah.
Yeah. Yeah. Mostly cats.
Yeah.
Actually, my head dental tech, her cat went deaf.
Oh, wow. Yeah. And do you know Patrice Corticos?
No.
She's out in the West Coast, Seattle or Oregon. She's an amazing person. You should definitely interview her if you can get her on. She
Send her
does.
information to Gwen.
There you go, Gwen. Patrice Corticos with a K. She introduced me to an appropriate mouth gag, which is made of a semi-firm rubber that is a wedge that fits in the back of the mouth. And there is just no way you can crank the mouth open too much with that. Awesome. But she's a physical therapy type practitioner. I want to say she's a DO. She's Swedish, Norwegian, one of the Slavic nations. And she is amazing.
That's very cool. So you have a 14-and-a-half-year-old dog who gets normal dose of wormers every 3 to 4 months. Why? Not MDR1 affected, but your nearly 9-and-a-half-year-old dog, affected dog, also gets a normal doses, not in the heartworm area, and lungworm incidence isn't high. So you're not doing monthly dosing. Why would you deworm every 3 to 4 months? I
wouldn't. I mean,
I would be doing stool samples and heartworm testing.
Yeah, I would be doing testing because, there is so much value in information, data, testing, rather than just doing empirical treatment.
Yeah. And that's one of my problems with corporate veterinary medicine. A lot of times they have these protocols. So every 3 months when you come in for a checkup or twice a year, whatever, they run a stool sample, but then they automatically dispense a dewormer too. Why?
Yeah, no, I don't get that.
I mean, I know that stool samples are not 100%, but my dogs have never had a positive stool exam.
And we're not talking about livestock where, let's say horses, we know if there was a positive that the environment is seeded.
Right.
We control where our dogs go. It doesn't make sense to me at all.
Yeah. Yeah. Older dogs may be less resistant to worms than younger dogs. That's true. Young puppies and old dogs definitely have a weakened immune system against pretty much everything.
Yeah. And what would you say in your practice was the positive rate of fecals? Out of 100 fecals in dogs.
For the normal average adult dog, very low. For puppies and kittens, very high.
Yeah.
But for the normal
adult dogs,
house pet adult dogs, very low. Very low.
And I would say ours is like 2%.
Yeah, it's very low. And a lot of people in my practice gave no heartworm preventative, so they weren't giving a intestinal dewormer, or they were using very limited low dose heartworm protocols, the Safe Heart protocol. So it wasn't that we were preventing infestations that way. It was just dogs and cats are not that heavily exposed to intestinal parasites, depending on where you live and what their lifestyle is.
Yeah. Yeah.
So somebody asked about Merle's, is there a linkage between hair color and MDR1 gene?
At one point, they thought so, and more so, they correlated it to the amount of white on the dog. And there used to be this saying of
The white-footed disease.
Yeah, white feet don't treat was the mantra with ivermectin with reference to collies. But no, I don't think there is an association between being Merle and having the gene. But the Merle gene is a whole nother topic. And
we'll bring you back for that one.
We'll come back for that. It has to do with the length of the Merle gene. And we'll have Merles that their whole body is Merle. We'll have Merles that'll have 1-2-inch patch under their ear that's Merle. Genetically, they are both Merles, but breeding wise, that patch Merle will breed like a tri because of the length of their gene. And of course, then we have double Merles that are neurologically compromised. So
you had a lot more fun in genetics than I did.
No, I've just been in my breed for 25 years. And
yeah, this is why we need to bring on people who from all the different breeds to talk about, all the weird things that they get. Lori, thank you so much for doing this. We really appreciate it. I'll have Gwen get in touch with you about that Merle conversation. And I think you're going to see Gwen and Brandon up at your Healthy Dog Expo, because I'm pretty sure Hugh and I are going to try to do global. And since they're back to back,
it was the only date I could get.
Yeah, so it's fine. But I think you'll see them. And I'm sorry that I will not be there, but I'm pretty sure we haven't been to global for a while, and I think we need to do that. So thank you very much for agreeing to come speak with us. For those of you who have been on, and for those who missed pieces and parts, this will be sent to your inbox because you signed up with an email. So you will get a copy of this. And Gwen will send you links to everything as well. Lori, thank you so much. Everyone, have a wonderful weekend.
Take care.
Bye-bye.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com.